COVID-19 tests leading Virginia to shatter a record for COVID-19 cases. Over 12,000 new cases reported to the VDH in just the last 24 hours. The positivity rate also jumping to an all-time high, now at 17.4%.
But Governor Northam says while the numbers are concerning, they are not a reason for panic since most are experiencing only minor symptoms. We're on your side with a live team coverage tonight on the surge in cases, the demand for tests, and changes for local college campuses.
Let's start with Karina Bolster, though, live in Chesterfield, where more people are frustrated that they just can't get tested. Karina?
Well, McKee and Simone, that's exactly right. Whether it be a rapid test or a PCR test, many of the folks I spoke with today tell me trying to get an appointment or even just standing in line at a testing event has proved incredibly difficult. But there is another factor the director of the Richmond Henrico Health District says may be impacting what's going on right now.
Some of this is a limitation on actual tests, and some of it is a limitation on actual staff.
It's been an incredibly busy last 22 months for Virginia healthcare workers. Dr. Danny Avula saying a shortage of staff is hurting its testing capabilities, but we're also dealing with another combination.
The time of year and the surging disease is really driving the need for tests.
I know my daughter had to wait at least 4 hours when she went to patient first.
It's been a waiting game for many like Sandra Parker, waiting in cars and in line at various health district testing events across the metro area.
We're at home just coughing and blowing our noses, so I said I better get tested. I'm a school teacher. I'll be going back January 4th.
But for hundreds of people who turned out for a testing event in Henrico, they would have to wait for another day. Richmond Henrico pushing out this information 1 hour into it, letting people know they had cut off the line after reaching capacity. Meanwhile, 45 minutes before Chesterfield Health District's scheduled start, staff had already handed out its 150 test forms to fill out. James Stone was the first one in line, arriving 6 hours ahead of time. He's also concerned about the rise in cases.
Maybe people got a little bit complacent and started thinking they could start going out again without masks or anything, which maybe saw an uptake in positive tests, and people are starting to get a little bit more concerned.
Now, Dr. Avula anticipates there to be an increase in the demand for testing over the next few weeks as well, especially as folks gather for New Year's Eve and, of course, the transmission of the Delta and Omicron variants. Live and on your side in Chesterfield, Karina Bolster, NBC 12 News.
All right, Karina, thank you. Well, if you are looking to